good. So happy to see you, Dave.
Cool. Yeah, you too, Alex and Sandra. It's nice to see you for the first time, meet you for the first time.
Yeah.
Where do you hail from, Sandra? Where are you from?
I am just east of Lexington, Kentucky, in a little town called Winchester, Kentucky.
Oh, Winchester, Kentucky. Is that the same as Winchestertonville, Kentucky? I think that's a
Yeah.
place.
I haven't heard of that. Nope.
I think it's from a movie. Do you remember the movie with Adam Sandler called Big Daddy?
Yes.
I think there's a location in there that's called Winchestertonville. Anyway, you made me think of that. So, but
Okay.
Winchester.
Yes.
Is that hurricane zone, Sandra?
Now, we do have some tornadoes, but not hurricanes typically. We do have some weather that'll sometimes come north far enough that we get some remnants of a hurricane, but not a lot of those usually.
Okay, good. All right. Well, it looks like we're live, you guys. So
Cool.
I'm excited. Dave, you've got I'm going to say like a Paul Bunyan kind of look today.
Yeah, I do. It's a little chilly. I think I mentioned to Alex and Sandra earlier, I'm just on the road traveling, so uh but I got my mountain man look going on and just need an axe or something like that.
So you mentioned that the weather is a little bit, I don't know, I'm just alluding, but or assuming, is the weather pretty icky out in the Mount Shasta area of Northern California?
You know, it's not bad, but we're gonna get some snowstorms, some heavy snowstorms coming up. A little snowstorm tomorrow, and I was trying to beat that weather and get to the Oregon coast. So where it's a little bit nicer weather before that storm hits, because where I'm at in Shasta, it's just up in the mountains, and you kind of get, if you don't plan right, you can kind of just get locked in there. Well, I say that, and it's just because I'm in an RV that has wheels. So for me, it's a little more, I got to plan ahead a little bit and decide where I want to be. But
Yep.
yeah,
Yep.
on my drive, it's been so foggy, just dense fog. So it's kind of
Wow.
wild today. But
Yeah.
uh,
Well, out here in
how
the
are things there?
suburbs, yeah, the suburbs of Salt Lake, it's chilly. We're kind of in that funny spot where in the mornings you have to wear a jacket. Like I don't know by the afternoon do I wear a jacket or a sweater or what? Because you'll overheat or not be prepared or whatever. But it's nice. It's super nice. I'm hoping to get one more lawn mow in before we get any weather.
One more long.
Sandra,
Nice. Yeah.
have you?
Are you a
Dave has,
gardener, Sandra?
yeah.
Well, yesterday we actually had snow. So it was our
Wow.
first snow of the season, which is it's not necessarily uncommon, but it's not always typical to have it this early. So we did have a little bit of snow yesterday, but it's supposed to warm up. We're going to be in the 50s and 60s for the next week or so. So that's good. But
Nice.
Kentucky is one of those states that you just never know if it's going to be cold or hot or
Yeah.
never know what's going to happen here.
Crazy. Yeah, hopefully you'll have good weather for Thanksgiving
Yeah.
plans, traveling for holiday. Do you have anything coming up fun in that regard, Sandra?
We're going to travel to see some family on Thanksgiving, and then Christmas I'll host a family dinner as well. So yeah,
Oh.
looking forward to it.
Well, fun. That'll be
What
fun.
about you, Alex? What are you doing for what are your Thanksgiving plans? Are you doing an AAPC Thanksgiving
Well,
this
we
year?
we are we are doing that. I mean, not my family, but and let's see. I think it's next week we have the the company potluck for those who are in town. Sandra, as you can see, like not all of us are in town. Dave's in another state, as many of our employees are. But yeah, um, but we just stick around town usually for our family stuff, and looking forward to that. I had a great Halloween. I don't know, did you guys have
Cool.
a fun Halloween?
Yeah, yeah, it was
Yeah.
good.
Yeah, it was fun. I ended up trading in my car on Halloween, so I spent Halloween in a dealership doing transactions, but it was good. Yeah.
All right.
Last day of the month, they're getting you those good deals.
I know it was
That's
funny
right.
how the timing worked out because I was, I was far away. I was actually going to trade it in, and they're like, "If you can make it in by the end of the month, we'll be really pumped to get this deal done." I'm like, "All right, whatever, guys. Sure, we'll help you hit your numbers."
Yeah.
Well, no, I
Well,
love the holidays though, and Thanksgiving coming up. Actually, my birthday's next. What day is it today? It's in like It's the 12th. It's on the 25th, so it's coming up.
All
It's like
right.
days before Thanksgiving, so I'm gonna attempt to drive across Oregon, Nevada, into Salt Lake City and visit my family up there and say hi to them. That's kind of my plan. So,
All right.
Very nice.
That'd be fun. Good to
mhm.
get you back in town.
Yeah, yeah. If I'm there for any extended period, I'll try and pop in the office and say hi to
Yeah,
people there. So,
that'd be awesome. Okay, well, if you're watching, let us know where you're at. Let us know how the weather is in your neck of the woods. As you can see, we've got Sandra Pierce with us. So I was saying to Sandra before we went live that um, our one of our social media content creators, the medical coder, Maddie, he's been posting things like imposter syndrome and finding self-worth or don't undersell yourself, things like that. And then when I was reading the magazine, AAPC The Magazine, the November issue, I stumbled on Sandra's article, Know Your Professional Worth. And before we jump into that, Sandra, tell us a little bit a bit about yourself professionally and what you do now.
Okay. Well, about, I don't know, 16 or 17 years ago, I was working in office management. It's about the time that the housing crisis hit and the economy tanked, and I lost my job as an office manager. So I had to reinvent myself. It took me a couple of years to, figure out my pathway. So I went back to school, and that's when I picked up coding. And I became very active in the community in our local chapter in Lexington. Um, so that's how I got back. That's how I got into this field. And I have worked in a couple of different places. I did some work for a hospice organization. I've worked for a couple of different hospital organizations. I currently work as an educator for physicians in behavioral health. That's a really interesting section of coding that's newer and coming up. Like it's a big deal right now. So that's been very interesting. So that's kind of what I've been doing. I've started as a coder and I've worked up to audit and education. I also teach within the local community college in the MIT department. So
That's
I do,
awesome.
yeah.
You've done a lot of different things, and so you were set on just resuming with your office manager role, and then you were laid off and were forced to pivot a little
Yeah,
bit.
had to pivot, had to find a way to make myself marketable, to become employable again. And I've kept that mindset at once I started, in this field, I had to continue to make myself marketable. So what will make me marketable moving forward? I don't ever want to be in that situation again where I don't know how I'm going to provide for my family or myself. So that's why I've continued to grow and navigate and learn new things within this field so that I have a broad range of knowledge and I'm well rounded so that I can, again, make sure that I'm always employable.
Yes, yes. So what led you to write the article, Know Your Professional Worth, in the
Part,
magazine?
part of it is teaching and, seeing people like me, well, 15 years ago, not knowing what I was going to do, or when I first started, hearing things like, well, you're just a coder. Well, no, you're not just a coder. You are a very significant portion of the whole revenue cycle. And without a coder, that cycle isn't going to be complete. And so you're not just a coder. You have, and I've tried to explain that to students and to my colleagues. Like we have to remember that we are valuable to our employers and our community. We have to make sure that we maintain that in educating ourselves, maintaining, like I was just saying, our credibility as well, like making sure that we know where to go when we need assistance. So it's all about coming, all together, knowing that we are important and we have a value.
Yeah. I'm going to quote from your article, and I think this is an important one. It says, coding is not an entry-level job, a back office task, or a job you simply do. A job is something you show up for. A profession is something you commit to. Are you ready to put your best foot forward and show others your worth? And in our social media communities, I often see people stating that, because I think there are those who come in or are seeking the field because they see it as a potential work from home opportunity, which it absolutely can be, but without thinking of it as a career.
Exactly. Yes, that's what I try to stress. Even when I went into it, I never ever thought about that one day I would be working from home. Um, so I went in. When I was actually going through my education to learn how to code, I put my all into it. I treated it as a full-time job to learn it, to network and meet as many people as I could within the field who could help me, not just to later find a job, but to help me understand it so that I could be the best possible coder that I could be. And so I think that it's really important to remember that this is a profession and we are professionals. So,
Yeah.
yeah, I think that it's a very important part of what we do, and making sure that we remain professional and know that we are professional as well.
And I feel like, Dave, we see this shine at our conferences. Like when we interact with our members, you see that professionalism, their dedication to the craft, and that it's just not a paycheck, a job that they can just phone in, I guess.
No, it's definitely a lifestyle for most of our members. It's like it's all encompassing. They're immersed in whatever their specialty is, but yeah, they love it. But what's cool about that though is that love and that desire for or passion for it translates as confidence in a lot of times. And so I think the two can go hand in hand. Being exuding that confidence because you're just excited and you're happy about what it is that you're doing and you're learning and or maybe you've reached a point of mastery in your career, but um, all of those things I think will help build that confidence. So you can, like Sandra, like you've done, pivot and be able to hit the ground running, in a completely different specialty.
Yeah.
Well, I feel like AAPC gives that opportunity, right? Like Sandra came from, well, you were in the office, Sandra, so you had those office skills, but there are many who don't. AAPC gives that experience and opportunity to refine those things that you call out in the article. Remain professional, being professional at your local chapter meetings,
Sure.
opportunities to present, and let's see here.
Networking
Yeah,
is huge too. Like we have to network. Yeah.
absolutely. Sandra, did you ever feel like you were this person where you didn't feel like you knew your professional worth? Was this an article kind of expressing what you may have felt at one time?
Absolutely. Yeah. And it took a while. It took a while for me to realize that I was worth more. And I spent quite a few years with an organization that I didn't feel like really valued me as much as I felt like I was worth. So that's a big part of why I wrote this article is I want this community, my colleagues, to understand that we are worth a lot. We are important to to our organizations, to this field, and we have to know that what we're worth. It's important.
Yes. You also highlight seeking answers, and we often talk about coders being investigators who love to put puzzles together and
Yes.
put the
Yep.
story together with codes. Uh, and I keep going back to conference, but it's and local chapters too. But that's where those are great places for our professionals to seek and find those answers. How has how has that been for you as far as your local chapter meeting and conference you may have attended?
Well, it's invaluable. Our local chapter is phenomenal. We have a great chapter. I'm a member of the Lexington chapter, and we have some of the most loyal and great humans in that group. And we have great speakers every month. We have great attendance at our meetings. It's it's such a great community to be able to talk with other people like-minded in our own community, in our own, field, who may not be in the same specialty, but have the same general field of knowledge, and so we can bounce ideas off. We host great coder workshops like Coffee with a Coder, and we can go talk about specific cases and help each other out, help figure out how something should be coded, or how, a new technology or something that's coming along. We can talk about those things and help one another learn those new ideas or things that are happening. So
Yeah, it's always evolving, right? The industry is always
yes, there's
evolving. You
always
have to stay on top of that. So how will you, viewer who's watching, how will you choose to find those answers to the ever evolving landscape of the revenue cycle?
yeah, it's always something that you have to read. I mean, I read a lot, I'm always looking. I follow a lot of people on LinkedIn and see, what are they talking about? What's new? CMS, our local MAC, all of those things are so important to really understand how to research on their sites, and then understand also not just those organizations, but who are some other true leaders in this field that we can help look up. Who can we look up to, and who can we, trust their advice. So I think that's always important as well.
Yes.
Yeah, it's interesting. And I get those figureheads probably change per specialty, right? So when
Oh,
you pivot
absolutely.
into
Yeah.
behavioral health, all of a
Hmm.
sudden it's like it's a new foray of people that are involved in that and people to follow, people to learn. I don't the shadow. I don't know what you'd actually call it, but do you would we know some of these people in the industry that maybe are these AAPC members that maybe are like sort of mentors or been in the behavioral field area for a while? Are there some
Oh, I
names
think
that you could throw
I
out?
I don't think there are that many in behavioral.
Yeah.
I think there are, but I don't think that I have personally met many of them. I do. Betsy Nicoletti does a lot on coding intel that is related to behavioral health, so I do follow her. Um, Behavioral health is definitely up and coming and a big thing going on right now. I recently wrote a letter to AAPC asking that this become a new credential that we can be certified for. I think it is it's blowing up. Behavioral health is blowing up, and I think it would be a great credential for a lot of our community to be able to test for.
Hmm.
Yeah.
Why do you think that is that it's blowing up, that it's getting so much traction right now? Is it, I mean, health goes hand in hand with like, is it like mental illnesses too? Is there an increase
Yeah,
in
I
that
think
and also an increase in the
yeah,
need for
I
mental
think
health?
people are more willing to talk about mental health issues now. We have these substance abuse issues throughout our country. So I think that's going hand in hand. And we have a lot of people who are more willing to talk about it now than before. It was kind of taboo to speak about before. And so now I think that's why we're having more people reach out for help with their practitioners. So that's why we're seeing such an uptick in behavioral health services.
I agree.
Yeah.
Yeah, I mean, this explosion, and you see, prominent people who openly talk about seeking therapy or medication to help through those behavioral or mental health challenges. So that's
Yeah.
cool. All right.
Yeah, it reminds, sorry,
That's
another
fine.
tangent. It just reminds me of just our school curriculum, right? Our public school education. Like we don't talk about how to deal with, I mean, maybe how to deal with like stress, how to deal with anxiety, how to deal with like all of these things that could plague us or eventually do plague us as adults because we've just gotten so worn down by stresses of life. Um, but I feel like there's maybe an education opportunity that we're also missing in the education system to really, like you said, to talk more openly about these things, talk about them with kids so that they know that it's like, hey, you're not alone. A lot of people feel these different things. And I don't know, I could definitely see that expanding. That makes a lot of sense, Sandra, why, you know, you said that the openness.
Yes. Yeah. It's been very interesting for me. I mean, it's a newer field for me, a newer specialty. I really just started working in behavioral health about 18 months ago. So I've kind of thrown myself into it and tried to find any possible way to educate myself on the subject. AAPC does offer a certificate course, and I took it, and I have any possible educations that I've found online, I have been enrolled in. So yes, it's growing and it's very interesting. And my providers are phenomenal. Like it's such a great group of people to work with too. So
It's cool. So I'm curious about your article too. Did you reach out to be like, hey, I want to write an article for the magazine, or did they reach out to you? Like what was that process like?
I submitted it after I wrote it. I submitted it to AAPC and it was chosen. I was very honored that it was chosen. So yeah.
The
So
last the last heading in your article talks about choosing a path. And this may have been you, Sandra, but I see so many coders who come in thinking I just want to code and not realizing the
Yeah.
different possibilities that there are. And you're in behavioral health now. So even thinking about specialties is not on the radar.
Mm-mm.
What can you tell us about choosing that path? Because you might start out as a coder, but there are so many different ways you can or directions you can go.
Sure. Well, and you don't know what you don't know. So getting started, I had no idea. I had absolutely no clue the the many different avenues that I could take within this career. That is what I think is so wonderful about what we do. There are so many ways, from specializing in maybe IR or specializing in surgery or behavioral health or maybe going to leadership or doing something with compliance or auditing or CDI. There's just so many different avenues that we can take within this field as a whole. And I don't think many understand that when they first started. I didn't. I felt I was very, very green. I had no healthcare experience. I worked in the service sector. So I didn't have any healthcare knowledge whatsoever when I started. And I really threw myself into it. And like I said before, I treated it as a full-time job, learning and getting to know people because it was dependent on me to get back into work. I needed to get back to work. And so I really, threw myself into it and threw myself into the local chapter and met as many people as I could. And I'm so grateful that I did.
That's awesome. Well,
you oh, sorry, Alex.
go ahead, Dave.
I just had another question for you. In your article, you mentioned community and the importance of forming community. Have you been able to, you said for 2 years you've been doing the behavioral health stuff. Have
Mm-hmm.
you been able to kind of form a community? Has that been growing? How are you feeling in that regards?
Yeah, within where I work, certainly I have a community of coders and team leads and managers here that have been great, and not just on this side, but within our um, our partners who are treating the patients, the doctors, the social workers, all of those who have formed a community with them and been able to really discuss things that are happening and up and coming in their service line. So that's been good. And then I have reached out to a few people within my chapter who also do behavioral health um, or work in that kind of field. So it's been good. Yeah, I'm meeting new people, and that's phenomenal. So yeah.
Yeah, yeah, that's awesome. Well, yeah, I was curious about the local chapter and if you had some people in there that were also involved in behavioral health.
Yeah,
So
there are a couple, and so that's been helpful. And then just being able to talk to my providers that I work with that's also been very helpful too.
Well, Sandra, thank you so much for sharing your story and sharing your article in the magazine.
Thank you for
And
having me.
oh, you're welcome. And I'm sure, I mean, I know this is a topic that needs to be addressed. So thanks for giving our coders, especially our new coders, a boost.
Well, I appreciate it again. Thank you so much for having me. I was honored to be asked, so thank you.
You're welcome. Okay, we hope to see you again sometime, Sandra.
Yes, thanks.
Bye.
good to chat
Bye.
with you.
Yes, you too. Nice to meet you.
Nice to meet you. All right, Dave.
Cool.
Let's
That's awesome.
see. All right. Yeah, she's great. She's
Oh, yeah,
great.
she's in Kentucky. Hopefully she can swing on out to Dallas in May.
Is that close? Would you call that? I know.
I would call that close. Kentucky, Tennessee, I would call that somewhat close. I don't know.
Yeah,
My
she's great.
geography there is a little she's in Kentucky. Hopefully she can swing on out to Dallas.
Brian Boyce.
Is that close? Would you call that? I know.
I would call that close. Kentucky, Tennessee, I would call that somewhat close.
I
don't
hear us. Do you hear us, Dave?
There's she's in Kentucky. Hopefully she can swing on out to Dallas.
Brian
Is
Boyce.
that close? Would you call that? I know.
I would call that
Let's
close.
see here.
Kentucky, Tennessee, I would call
Brian,
that.
if you're watching us,
I
would you
hear
hit
us.
mute?
I
Hear
hear
us,
us.
Dave?
There seems to be an echo that is echoing the whole meeting audio back in. So what Alex is saying and what I'm saying, we're also hearing, I think, through your laptop as well. It's kind of being pumped back in. Can you check your little drop down next to your audio? Or I guess it's a arrow up. And so what Alex is saying and what I'm saying, we're also hearing, I think,
I just
through your
muted.
laptop
I-
as
I
well.
did-
It's kind
I
of
did
being pumped
mute.
back in.
We can hear you, and that's great. But maybe the player in Facebook that you're watching us on, hit
Oh.
mute on that.
Yeah, that's probably what it is. Yeah. I mean, you sound good, Alex. I'm not gonna lie.
I'm
But
blushing.
just don't need to hear it twice, is all.
Brian, why don't you unmute yourself on the Zoom? Can you hear us?
Yes.
Perfect. Perfect. See, you know when you hear yourself talking on a recording, you just kind of you want to melt. That's what I could hear myself through that, and I felt very self-aware.
Yeah. I did have the Facebook thing on, and I thought I had turned it off. I apologize. I wanted to hear Sandra, and I wanted to hear what she was saying, and I thought it was great.
Yeah.
Yeah.
Well, Brian, we're so excited to have you. When I saw you featured in the magazine, you're on the cover.
Yeah, I
And
had no idea.
well, was this your first cover? Because you've been a member for a
Yeah.
long time. First
Yeah,
cover.
yeah, definitely.
All right.
Yeah.
And when I saw that, I jumped to your article, and of course, the first thing that came to my mind, and we spoke about this, is how you have a long history with supporting AAPC members. You served on the National Advisory Board. I believe that was during Jackie Caprios's tenure. Is that right?
Yep. Yeah, 2015 to 2018 with
Okay.
Jackie Kiprios. Yep.
And you were president, maybe you are now as well, but of the famous Richmond, Virginia chapter, RVA.
I was a former vice president, and I'm just a member now.
Okay. All right. So just enjoying it.
Yeah.
All right.
And Brian, what part of the country are you in? I always like to ask that.
I'm in Richmond, Virginia.
Oh, you just said Richmond, Virginia. Nice.
Yep.
Cool. It's
Mhm.
pretty
Yep.
there.
So, Brian, tell us what's been going on in your world since you've been a National Advisory Board member. I know you had Ion Health, you ran that, and now you have a new company.
Yeah. I successfully ran Ion Healthcare. I was really pleased with it. I'm actually the original author of the CRC. I brought that to the AAPC. I had worked for two very large companies actually in that space, and understand it quite well. And I didn't like, to be honest with you, where the second company was going after they purchased the first company. And so I decided I could do this better. So that's why I started Ion Healthcare. The pandemic hit us very severely because a great deal of our business line was with national audits for Health and Human Services. And while CMS did not stall their RADVs, HHS did. And so it was quite an expensive company to run. It cost about $2 million a year to run the company. And so we had very successful 8-year run, but then that last year, even with some investors that I involved in the last year, which was probably a bad idea in hindsight. I thought it was the right thing, but it wasn't a good decision. Yeah, we just closed it down. I actually had long COVID. I didn't tell a lot of people that. It was quite severe for me. I could hardly walk or move for almost 3 years. And I didn't tell anyone because I was afraid I wouldn't get any work. So so I kept it to myself, and I'm much better now, thankfully. But it took a long time to get there. Started a new business called Health Administration Advisors. I just rebranded it this year as Refinica. It's at refinica.com, doing a lot of the same things, but integrating also my health administration background and assisting with lots of things. I used to work in physician practice settings before I got into coding. In fact, that's why I got into coding. I actually worked with Jackie many years ago at the Bon Secours Health System in Richmond. She approached me because I was doing a lot of provider education and staff education on multitude of things like diversity, sexual harassment, HIPAA high tech, fraud, waste, and abuse. And she liked my teaching style and said, "Hey, have you thought about becoming a coding instructor?" And I was like, "Well, no, but maybe I should." And that's kind of how I got into it, really.
What blows me away, Brian, is you started out as a clinician. You were a nurse in the Air Force.
Yeah,
Can we just start there? Like,
sure.
so
Yeah.
you joined the military and you take going down the clinical path.
Yeah, well, I did a year of college, but I didn't come from a wealthy family. And back in those days, you couldn't get a student loan on your own. Your parents had to co-sign, and my father didn't want me to. He wanted me to do it myself. And so I went into the military to kind of gain my independence, really. I could have really done anything. I'd scored very high on my score on all of my tests. I was always a good student. In fact, the recruiter was trying to get me to be a jet mechanic, and I was like, well, I'm not really interested in being a jet mechanic. And so I scored so highly that I was able to do aeromedical evacuation. So that program, interestingly, a lot of people don't know this, but the physician assistant career path actually came from corpsmen like myself from Vietnam. When they came back from Vietnam, they were more than a nurse, but less than a doctor, and they didn't know what to do with people who had our level of training because it's quite intensive. In fact, I did a month-long training in every didactic you could imagine, from neonatal, pediatric, surgery, ER, you name it. We have this big, thick, I would say phone book, but I don't know if the young folks would know what a phone book is, but we had like this big, thick booklet that we had to get checked off on skills and procedures. So we did lots of things. I delivered 6 babies by myself.
Wow.
We did skeletal traction, assisted in the OR. It doesn't transfer to a license in the state, in most states, unfortunately. The corpsmen kind of got left behind after the PA programs got established, and there's not really an easy pathway. You just kind of have to start over from scratch. And that was kind of what I was looking at the time. And so I decided not to stay. I did stay in clinical for a long time. I worked in the coronary ICU space. I worked in physician practices as an office nurse for many years. I began doing more of the administrative because I saw an opportunity to have a better career path and make more money, to be honest. And so I became a practice manager, still going to school part-time, and finished my bachelor's in health administration at ODU, who did take my military credits, and then went on to George Washington University's Milken Institute of School of Public Health for my MHA. And I'm quite proud of that. I stayed with the coding because it was just the path that I knew, and having helped set up all of the programs for former clients at the old companies, I knew I could do it myself at my own company. And so that's kind of how I ended up where I did.
What do you love about it most? I mean, obviously you're drawn to this
Well,
space of healthcare.
it's a love-hate relationship sometimes, honestly. I would say this, one thing I often tell people is, I found very quickly that I could help individual patients one at a time with the stethoscope, but I could have a greater impact on policy and procedure and population health with the pen. And so I realized that there was an opportunity to still have an impact on the outcomes and positive patient experiences on the administrative side and doing things that would affect huge groups of people rather than one at a time. So that was kind of what drew me in the most, probably. I still do a lot of health administration level work. I used to create policies and procedures for our old companies, and I have a certificate in clinical bioethics, so I do some consulting there. We have a platform, an online platform, and we do legal work as well. So it's kind of a varied experience, I would say.
Do you
Yeah, I
ever
guess-
miss the?
Oh,
I just gonna ask real quick, Dave. Do you ever miss the clinical side?
Yeah, I do a lot. Uh, I really do. I had a really good, I would say, I think I had a really good talent. I mean, I was the guy they would call all over the hospital when I worked at the hospital. If somebody couldn't get an IV, they would call Brian in the ICU. He can get it. And I was really great with patients. I probably, I did lots and lots of work, but the things that I remember the most was working with patients who were dying or working with families with patients who were dying. I got very good at that, and just being very empathetic toward them and helping them through that process. Um, but
Hospice nurse, I guess,
it
kind
was
of.
like in the hospital setting
Okay.
where folks weren't having a good outcome,
Okay.
or we didn't expect them to have a good outcome. So I did a lot of that. In fact, one time um, I was helping a transport and the patient coded in the elevator, and I was just me and a resident. And so I was already certified in ACLS, but of course in the state I didn't have credentials, but under a doctor's license you can practice. And so I just talked her through and we saved that patient.
crazy.
I got scolded for it afterwards, but the nurse manager thanked me because she knew the patient and she was like, actually, you saved his life, so thank you. And I said, well, thank you. But yeah, I do miss the clinical a lot, and I've sometimes thought about going back in that direction, and who knows, maybe I will eventually. I don't know. I'm getting older now, so who's to say?
Yeah, I pulled up your website when you mentioned refinica.com just to check it out. First of all, it's a great looking website, like the logo a lot and everything. It looks really good.
Thanks.
Looks like you have a couple different platforms or software packages, right? Do you want to take a second and explain what those are?
Yeah, sure. Thanks for the
I was
plug.
reading a little bit, but it might be fun to just explain.
Yeah, I was the key person who developed platforms previously for the other companies in the space, and unfortunately, like in that last year, I was unhappy with where the new company was going. They were making a lot of edits and they were using a lot of AI. And I'm not against AI, but I think we have to be smart about how we use AI. And I didn't really see that happening. And so I developed a new platform. It actually was developed in 2015 and it's been enhanced year over year. So it was a platform originally made for risk adjustment, coding and auditing in particular, but soon within a year or two, I changed it up and we modified it so that you could use it for any coding audit. So if there were coders out there in the space who were doing their own audit work, they could use the platform. It has CPT modifiers, all the ICD, and all of it's tied to the date of service of the encounter. So it already is kind of a smart system because it will only allow you to code for things that were valid in that year, or for that date of service when the encounter happened. It also does HEDIS and other quality measure reviews. We modified that a year later. And we had a couple of clients that were like big health plans. One of the big five actually was one of my regular clients for over 2 years. And they had some special quality initiatives that weren't part of HEDIS that were just extra. Like they wanted to monitor patients who had urinary and fecal incontinence, for example, or major depression. And so we had enhanced that. So we have the platform that's able to do both. And this year we enhanced it further to help with law offices that are working medical cases. So for personal injury, workers' comp, that kind of a thing, it can be used for those types of scenarios as well.
That's really cool. Yeah, seems like it's really flexible and that you can kind of customize it to the client's need.
Mhm. Yeah, and we do use some AI, but we're careful about how we use it. We don't, a lot of the systems that I see out there don't use it appropriately. I've been called in on a couple of audits the last 2 years. In fact, they were RAD-Vs, a couple of them, where things were going in a bad direction, where people were refusing to code for things, even when they were found in the assessment and plan, because they felt the provider didn't say enough, or the AI tool that they were using was bringing in stuff and I think it was a bit, I want to say it appears to be, can't say, but it appears to be that it was very monetary driven in some of those cases because, for example, a brain hemorrhage only risk adjusts when it's traumatic. And so there were a lot of things that would say traumatic injuries when it wasn't a traumatic injury. And so there were a lot of I don't know. There were a lot of what I would call like poor kind of low level mistakes. I've also seen platforms out there that the AI is all first pass coding is all done by the AI, and there's not always a review for the new stuff coming through. And so that's been a problem in some of these audits as well. It doesn't really look good on the health plans of the groups that need those RAD-Vs done accurately, and it looks bad for the company. And we avoid all of those things because we have the smart system that identifies anything that's new right away. And it will identify things that it thinks might be there, but it doesn't automatically assign them. It requires a coder to review it.
Oh, that's cool. Like giving suggestions or possible.
Yeah, it highlights keywords and phrases for the coder as opposed to actually coding it for them. Um, Over time, I think it could be developed to code, but I think jumping to the coding is kind of putting the cart before the horse in the AI world.
Mm, gotcha. Yeah, they need to be able to parse accurately the documentation, get the right information, and then code it. Right.
Yes.
Yep.
Yeah. Yeah.
And it's not getting the right info. Well, at least based on what I've seen with my own personal usage of AI, it's not totally accurate. It's got some flaws.
Yeah, it's very easily tripped up, honestly. So I hope that people kind of hit the pause button, but I don't see that happening, honestly. It would be great if they would hit the pause button and just say, wait a minute, let's just reevaluate how we're going about this to make sure it's accurate. Because, at Health Administration Advisor / Refinica, we take it pretty seriously and we stand behind everything that we code and collect and audit. But a lot of other companies they do all this work and then they ship it to the client and then they wash their hands of it and they're not the ones who have to answer to the OIG or the Department of Justice. I'm on 6 of those cases actually as a witness in some of those cases and going back and re-reviewing what happened, I've just seen a lot of like just poor mistakes that could have been averted that didn't necessarily need to happen.
Our members it seems that there are many who are entrepreneurial minded and you see them take off with like their own education platforms or whatever. Brian, you kind of jump. I mean, you obviously have this desire, or ambition for to help provide services that help our industry. What led to that? I mean, you've been a clinician, you've been a coder, had your hands in many different aspects within this industry, and now entrepreneur.
Yeah, yeah. Um, I think the clinical background definitely helped. I can't deny that. I scored very highly the very first coding exam that I took because I think there's a difference in having worked in the space and knowing and being able to visualize what's happening at the bedside or in the office. And because you've been doing it for years. And so you readily understand why there are so many different CPT codes, for example, because you know that there are these different approaches or different modifiers that need to be used to express what was happening. And all of that came very easily to me. I would say probably one of the biggest challenges for entrepreneurs who are interested in expanding, I would say, is just keeping abreast of the constant industry changes. I think there are going to be a lot more in the next few years from what I'm seeing already. And I would just say that, make sure you have all of your ducks in a row. Like we use a HIPAA compliant and secure formatting and double check all of our securities because there have been so many leaks by some of these bigger vendors out there. where they're not locked down tight enough. In fact, I've gotten letters that in the mail that said my data has been exposed. So I think that's a big concern to keep an eye out for. And of course, make sure that you have all of your business insurance in order, because, getting business insurance and errors and emissions insurance and even cybersecurity insurance are all really important things depending on the area of business that you work in here.
Yeah, cover yourself.
Yeah.
I have a question to switch gears just a little bit. I was thinking about, you mentioned that you co-author or not co-authored, you authored the CRC credential, our certified risk adjustment credential. I'm curious who you worked with on the curriculum side with the AAPC headquarters to do
Mhm.
that. What were some of the people that you worked with to create the credential?
Sure. So I had written it all myself from beginning to end because I had already been training coders, and I actually approached them because there was a lot of like backroom talk about risk adjustment that was happening, and some of the coders were asking for what they were calling an HCC credential. And the AAPC's response to that was, we've never made a credential that was based on a payment model before. That's not really the avenue the AAPC has taken from a business standpoint. And so I spoke with them, and Ray Marie Jimenez is one of the first people that I spoke with. She was great to work with. And I explained to her the difference. And I said, well, I wouldn't say that it's that, because what people forget, and I'll tell you, it's interesting, it's still happening today even, because the OIG, the number one mistake, the people who created the HCC model for Medicare, RTI, Research Triangle Institute, a great think tank full of very intelligent people from clinicians and statisticians and more, but they made a couple of small mistakes. The first mistake that they made was they created this program and they gave it to the CMS as a tool because a lot of the data was not flowing through on the claims data. And so, surprise, patients have additional comorbidities that no one ever knew. It wasn't on the radar. And so it was never the intention to be used as a fee-for-service audit. And that's what we've all been used to. E&M, we're taught that from day one in coding class, right? E&M, auditing, making sure you have your level of service right. Was there medical decision-making for each of the diagnosis codes? But risk adjustment is really a different viewpoint. So while providers and the claims are still important, that the claims and the providers are educated, and that what's being reported on the claim is connected to what was done in that each encounter and visit, that's not what risk adjustment is. That's fee for service. Risk adjustment was really intended as a population health tool to identify, okay, well, what are all the problems that, say, Brian has, for example, whether it's a metabolic disorder or whatever, and it doesn't matter so much that it was treated in that date, although the OIG would say there's a problem there. And part of that problem is some of the vendors that I talked about earlier, where some of these systems will rewrite claims data and they'll submit diagnoses on the claim because they think it's safer to be on the claim instead of being a supplemental. And a lot of these diagnoses really should be reported as supplemental diagnoses and not on the claim. And that's the biggest mistake that's happened across the board. And so a lot of people are under the impression that it's not, it's not reportable if it wasn't treated. And that's not what the intention of risk adjustment really was. But it's kind of headed in that direction. It may fold in on itself if people don't speak up and change the way that they're approaching it, to be honest with you. But once I submitted that curriculum to the APC and I had the whole thing done, I mean, I had my niece even help with the illustrations that we used in the book. And so once I had submitted all of that, there was a committee of people at the AAPC who were other instructors. Many of them I knew, a couple of them I didn't. And they were editors, and they went through and reviewed stuff and made suggestions for edits. And some of those were taken and some of them were not. And then an exam was created. And the exam, I did have like questions that were pre-made for each of the end of each of the chapters, but some of those were reworked. And then there were 6 people on the exam committee that helped develop the examination. I was one of those members, and I invited a couple of people in the industry who would be really good. And Donna Kober comes to mind, Lisa Larimore. There were Eunice Sanchez. There were a couple of people who were really integral in helping to look at the final exam data. And so, once that final exam then was created, then we started the beta testing of the program. I think some of it's been changed since I originally wrote it. I think some of it has been edited since then because there are like yearly changes with risk adjustment modeling. Like there are changes in what comorbidities count as combinations. There are changes in coding intensity factor because they always compare what was coded in risk adjustment against what's coded in fee for service because there's more intensive coding in risk adjustment side than there is in fee for service. So those factors change year after year.
Brian, did this happen? Did you propose the CRC credential to Ray while you were a member of the National Advisory Board or before? Do you recall?
I'm trying to remember. It was around when I had first started, I think.
Okay.
It was around, I think it was around the same time or right before or right after. It was in that window. I can't recall exactly. I want to say I was writing it back in 2013 and 2014, and I think I gave it to them in 2014 or 2015, and I started with the NAB in 2015. So it was right around in that time frame. I don't think I received any special treatment because of that though, because they were pretty like I don't know if we want to do this. And
well, I mean, but the relationship with Ray, did you have that before, and that may have given her some trust.
I knew Ray really well before. Ray has a clinical background as well. She worked in medical assisting for many years, and I knew Ray before she took on that big role over there. I think she had just started over there or had been there for a short while when I had reached out to her. But we had interacted before because, when you go to national conferences, you meet a lot of people, regional conferences, you meet a lot of people. Those are really great opportunities to network and meet other people who are in your industry or even hear from people that are in other areas of coding because coding really it's kind of like nursing in a way, I tell people, because, where I went to nursing school and in the military, you learn everything. So, but when you go out into the civilian sector, you'll hear nurses say, oh, well, I'm a pediatric nurse. And you hear that from coders, right? Like coders will say, oh, well, I'm an E&M coder, or, I'm a revenue cycle person, or I'm a risk adjustment coder. But truthfully, if you're a CPC, you really have to know a lot. You really have to know a little bit about everything, truthfully. And staying on top of things that you don't see every day, the conferences are a good way to stay on top of those things that you don't see every day. Jackie Johnson Kiprios was a great mentor. I respect her immensely. She's the one who kind of pushed me in this direction in my career a bit. And, having worked together before, and we were just co-workers, but then we became fast friends. And, she's one of those people that will be a friend for a lifetime kind of person, and, we call each other nowadays, even though I see her as my mentor. Sometimes she calls me and asks me questions, and I'll call her and ask her about something. So that continues. I mean, even if you've been an instructor for a long time, you still like reach out to your colleagues and your contacts and, get advice from a friend kind of a thing.
Well, I think that National Advisory Board members, we want them to use their expertise to help grow the industry, help maybe find opportunities for coders to grow and find new certifications. And this what you've done with the CRC or what you did really feels like something that stands out to me that really had a big impact because there are a lot of coders that carry that credential.
Yeah. I'm really proud of that. I'm really proud that I was the original author. And, I hope that the risk adjustment program continues. One of the things that excited me about risk adjustment was the potential of changing the way we deliver healthcare. Because instead of chasing after diagnoses after the fact, knowing what they have ahead of time and trying to keep patients out of the hospital or attack those best practices as soon as possible in the process, that's very appealing to me. Even as a clinician, like I see the benefit of that program and how it could really help, improve patients' lives because you're getting ahead of their diagnoses as much as possible. So I hope that it continues to track.
Cool.
Awesome.
Yeah, awesome. And good relationships. Ray, Jackie, I mean, they're awesome to work with and such great mentors and good friends too. So
For sure.
Are you planning on coming out to Dallas, Brian?
Undecided, maybe. I don't know. I mean, like it depends on what's going on with the airline too, right? Like it's crazy right now. Um, Depends. I do want to come back soon to some conferences because like everybody else, I need the CEUs too. But it's really a good place to network. For people that are interested in the National Advisory Board, I would say, don't go for that just because you think it looks prestigious. Be prepared to roll your sleeves up because it's not just sitting around a table and talking and giving expertise or making suggestions. It's, you have to be a team player, and there's a lot of work involved. That every conference is manned by people on the National Advisory Board. The National Advisory Board members are what make the conferences flow. And it can be stressful if you're not ready for it. So be prepared to work if you're going to go for the NAB.
Brian, what do you miss most from your involvement with APC? I mean, I know you still probably do things here and there, but is there something that you miss with the National Advisory Board or local chapters?
The networking is really valuable to me personally. And it's the good thing, I mean, the local networking and the local chapter is great, but then if a regional or a national, there's even like a broader networking opportunity to meet other people who are in the field, who might have seen things you don't see every day, or, every once in a while there'll be what I consider like just an amazing topic that's presented in one of the modules. And it's kind of groundbreaking. I think Karen Schwartz and Jackie Kiprios did one on opioid use, and that was one of those phenomenal ones. It was very good. Some of them for me personally, I'm like, oh yeah, I knew that. But sometimes you have those really standout ones and you walk away feeling like you just learned something very valuable that you wouldn't have gotten if you hadn't attended something like that. So I would say for me, the thing I miss the most about that scenario or that experience is just the networking and working with other people in the industry.
You just have so much knowledge. It's so easy for you to talk about this and you're passionate about it.
Well, I've been doing it a long time, so
I talk about it in my sleep, right?
yeah. I can get a little dirty with it sometimes. Yeah.
Well, it sounds like you have so much background with it. Did you, and now just, I know you don't have much time, but I'm curious about your platforms. Do you have any like web coding experience or any
Great question.
like C# programming skills? Do you nerd out in that way too? Or
Yeah, how did all this happen on that side?
Yeah,
Sure.
a tiny bit. I actually have a really great developer. I would say I know enough about coding to be dangerous on that side of coding, right? And in those fields, you say coding, you have to clarify what, do you mean do you mean IT coding or do you mean medical coding? But a little bit, but just enough to be dangerous. I would say I have a really great developer who's in Richmond actually, and he has a team and they use wireframes, so everything's secure. And then we do a lot of smoke testing before we deploy. So we do it all, the correct way and best practices way. Whenever I have an idea that I want to change something, one of the things that helps me with developing the tool is we practice it first. So we don't just like make it. And a lot of companies will say they have something and they don't really have it even built yet. We don't really run that way. It's already there. It's already tried and true. And if it's something that's a new enhancement that we've changed with the coding side of it, we test it out with examples, and we have like kind of like a playground where we test it before we deploy it. And so that's really helpful. So we know it's solid and it's going to come out right.
cool. That's so cool.
Right.
Lots of hats you wear.
I know that we're short on time, but I also wanted to say one of the things I did that I don't know if you know, in the state of Virginia, and there might be other states where this is happening, there was the Council of Higher Education came after me personally because I was an instructor, and they said that I had to be a school and that I was perpetuating as a school, and they threatened my business and everything. And I actually became a lobbyist, and I went and worked with the legislation, and I changed the law in the state of Virginia because what was happening is there were community colleges that were offering coding programs, but the people who were teaching the coding, they were taking federal dollars even and making people take all of these under classes and like English and poetry and nonsense in order to even just get to the coding part. And then the people who were teaching the coding part, it wasn't affiliated with AAPC or AHEMA, either one. And some of those schools are still ongoing, and you have people who graduate from those and they get a certificate and they think they're certified, and they're not certified by any official body or agency. So I went and challenged and I got to write the new law. So now coding instructors in Virginia can teach the coding curriculum. So
I see that on Reddit a lot. Just not a lot, thank goodness, but enough that it breaks your heart, because people spend tens of thousands of dollars sometimes on their community college course, and they want this career path, and they you need to look for a HEMA or AAPC credentials. So and not all of them offer that path.
A lot of people don't know, so they're just, they're unwitting, victims of the circumstance, because they want the career, they've heard about the career, and this school's offering it, this career school's offering it, and they think that's the ticket. Yeah.
Of course, I should have said AAPC first over a HEMA, but either one is great, but AAPC is a little bit better.
Yeah. Both sides think that they're better, I think.
Yeah.
But...
Well, Brian, it was so fun to catch up and have you on with us today.
Thanks for having me. Appreciate it.
You're welcome. It's great to see you. Dave, it's great to be with you. Glad you made it. Brian, Dave snuck in right as I was starting to go live.
Oh, nice.
So,
yeah, last minute I found a place to pull off and get my internet going so I could jump in here. But yeah, it was a lot of fun talking to you, Brian, and getting to know you a little bit and all the different things that you're involved in. You seem like a really brilliant person just from your delivery and from all the different things that you're involved in. It's really impressive. So keep at it, man.
Thanks very much. I appreciate it.
for our viewers, we will not have a second broadcast in November, because that's without put us right up against Thanksgiving, and same thing with December as well. So we have one more broadcast left of the year, the second week of December, and that does it. Thanks everybody for joining us. We'll see you next time. Thanks, Brian. Thanks, Dave.
Have a good week.
See ya.